Perfect. Good afternoon, everyone, and thank you, everyone, for making time to join on such short notice, and all of your questions and feedback that we've been getting thus far, in response to my email that I sent out overviewing the changes. So this has definitely been crunch time for us, and trying to get all of these updates made, as well as getting the communications out to all of everyone involved in terms of how it's affecting them differently. So we really appreciate everyone's responsiveness and patience as we get ready for this to go live, and hopefully. Hopefully it doesn't cause too much disruption to your inboxes and your existing ENS subscriptions, but it's kind of hard for us to estimate at this point. So we're just wanting to be overly prepared and hope for the best. So with that, we'll jump into the slides. I wanted to just provide first just a general overview of the requirement itself. So you guys just have a basic understanding of what the rule is, what it requires, and how it impacts the hospitals, as well as you as the provider community. So back in the late spring of last year, CMS finalized the interoperability and patient access final rule. And as part of that rule, they also updated their conditions of participation in Medicare, which they don't often do. So it was kind of a big deal. And what they said in this rule was all hospitals must now start sending, if you're not speaking, if you can mute yourself, that would be great. And so what the rule states is that all hospitals must now begin sending these notifications to a patient's PCP, SNF, and or any other member of their care team that the patient says they would like to be alerted as when they are in the hospital. So we know that all of our hospitals, the majority of the hospitals in the state, are already sending this data, and they're connected through ENS. So a lot of the work was already done for them from that respect. So we've been able to piggyback off that work to more closely work with the hospitals and just making slight modifications to their ADT feeds to be in compliance. So next slide. And just diving in a little bit deeper, I don't want to bore you with all the details here, but what the rule states is that the hospital must make a reasonable effort to send these notifications. And the notifications, have some requirements around the information that must be shared, what type of events need to be sent, and so really the biggest updates for this group to know as existing ENS subscribers is that we're now going to start sharing alerts on patients that are in observation status. And then we're also going to start displaying that attending provider field in the alerts as well, which will be a new field for us that we had not been previously sharing. And then, so aside from that, nothing else should really change in terms of the actual information and content that are in your existing ENS alerts. Next slide. And so going back to what I was just saying a minute ago, about, making sense for the hospitals to use ENS for this, because they're already connected to us. They're already sending us this encounter information. And we already have all of the connections out to you guys, the provider community, through our existing subscribership. So the alternative would be a specific hospital having to make a ton of different point-to-point connections with all of the different practices in their community. We know that's completely unrealistic. They're never going to have all of them. So using this notion of an intermediary service like ENS, or, other states that have HIEs with encounter services where CMS has already made investment, seems like a good use of funds and a good way to do it. So we've really endorsed the hospitals using ENS to route these out to the providers. However, a lot of the just go back. You can stay on that other slide, Brian. Thank you. However, a lot of the hospital EHR services are also developing their own routing mechanisms through Epic, through Cerner. And so some hospitals may choose to route the alerts out to providers directly from their EHR. And in those cases, we are, working closely with the hospitals to say, if you're going to use your ENS service, then you probably should not use ENS, or you should really just pick one or the other, because if you're using two methods to route, then that is a likely scenario where you guys as providers might start receiving a lot of duplicate alerts. So I really, the main takeaway here for this slide is to understand, as I alluded in my email, that there are a fair share of hospitals that are going to be using ENS to route these alerts out to you, but there is also a fair amount of hospitals that may be choosing another method to route these alerts out to you. So you may start receiving alerts to your direct inbox directly from hospitals as well. Next slide. So the way that this new COP compliant ENS workflow will be is that, and then why we are needing to start collecting the NPI information from you, is that now when an ADT message comes in from a hospital, they're going to be including those provider NPIs as well. Those are additions to their ADT feed that they've been making. And we will take that NPI. The NPI here is really just going to be the linchpin for the entire workflow. So we're now going to use that NPI to determine whether the provider is already an existing ENS subscriber, in which case we will then just route the message out to you on your configured ENS delivery location. So if you're currently receiving your alerts through prompt or through a daily CSV file, we're going to continue to send those alerts to you in that same format. Even if the patient isn't on your panel, you will receive that alert. If you are not an existing ENS subscriber, we will then query the direct trust provider directory, and if there's a direct email on file for that provider, then we will email it out to them to their direct email address. So the importance of being able to get that NPI number from you in your panel or via list that Brian's going to walk through here in a couple minutes is so that we are not sending direct messages out to you in your direct inbox, and we can send them to you via your ENS subscription. So that's really why we need to start collecting those NPIs from you. So what we've been doing to prepare for the rule is, as I mentioned, we've been working with the hospitals to update their feeds and offer ENS as a routing option. And then we are now working with the existing provider ENS subscribers on your panel updates to make so that the necessary changes are coming on the downstream side, so you're not getting inundated with alerts. And then we've also been educating the larger provider community on the coming rule, its implications on them, and then working to enroll more providers on ENS so they can streamline and improve the management of these alerts. And with that, Brian, I will pass it over to you to dive into the details of the panel updates.
Yeah, thank you very much, Ashley. So Ashley was talking about the high-level overview, the CMS rule of COP, how we're working with data senders to make sure they're meeting these requirements and the type of information they're going to be sending us. Where I think it really the rubber meets the road here is with you guys, because the number one thing we really want to avoid happening is you as provider groups, start saying, well, wait a minute, now I'm getting inundated with these direct messaging alerts to my direct messaging system, but then I also log into Prompt, or I pull down my daily CSV file in the SFTP site and I see the same notifications. I don't want to get them in direct message. Otherwise, I would have requested that when I set up my ENS subscription. So that's the whole reason we're setting this up. And basically for you guys on your subscription, we want to be really clear about this. Nothing is going to change with ENS. Nothing is going to happen with it. Everything can work the exact same way it does now. But there are two ways to avoid getting what we're going to say is duplicate notifications in a manner in which you, as an ENS subscriber, have said, we don't want to do it this way. The first is through a column header within your patient panel. So all you guys submit patient panels every month, every week, every 6 months, every year, whatever it might be. And basically what you can do is you can add an additional column and label it NPI, just like I have highlighted here. You can do it right after the cell phone column in column S, or you can do it all the way at the very end of your current custom fields. Wherever you want to put it, it doesn't matter. It just needs to go after the cell phone. So at any point when you say, you know what, we're going to start adding our NPI in our patient panel, so that way we can make sure that if any hospital sends data to the HIE with one of our NPI listed, we are then going to use that NPI provided in the patient panel to route notifications to you in the manner in which you've requested to receive it, through Prompt portal, or through a daily CSV file, or through real-time HL7s into a population health tool, whatever it may be. The ability to do this essentially allows us to make sure we do not send a COP alert to one of the providers that you have listed through the NPI. So that way a provider is not getting a direct messaging alert through the COP routing functionality, and in addition to the daily CSV or within Prompt. Two notifications probably are going to cause some confusion. So that's why adding the NPI as a column within your patient panel that you submit is going to essentially make that where it won't occur. The next option that you have would be to send just a big file to us and say, here are all the NPIs that we have in our practice, or you can send a practice level NPI. And I provided two examples here. So if you don't want to update your patient panel to include a column field of NPI, you could say, I'm just going to submit a one-time file of all the NPIs from all our providers, submit it to the HIE, the Florida HIE service desk at anq.com. we will go in and we'll add it to your subscription to make sure that any inbound ADT coming from a hospital with this provider MPI listed, route it to this particular subscriber the way they want to receive it, not through the direct messaging patient asserted method. So when you open up that document that Ashley sent on Tuesday in the email, there are two tabs in there. One tab says PCP level MPI, which means you'd list an individual provider's name, first name, last name, and then their MPI. The next tab would be a practice level MPI. The difference here is I call it more of like, do you want to cast a wide net and catch everything, or do you want to just kind of do it at the practice level? If you do it at the practice level, there may be a situation where a patient comes into a hospital and in the workflow, the attending physician says, hey, I would like to let you know that Dr. Sam Smith is my provider. And they say, okay, great, we've entered that in, and that's going to be routed to Sam Smith. If you, as an ENS subscriber, have only provided me the practice level Palm Coast family MPI, we're still going to send it directly to Dr. Sam Smith because the MPIs are two different things. So to capture everything, I would leverage both, do the practice level MPI and do the PCP level MPI. If you want to do one or the other, that's fine as well. Again, nothing is going to change with your ENS subscription. Just Dr. Sam Smith may reach out and say, why am I getting these direct messages? I don't want to get them anymore. Please make them stop. So if you can do that on the front end, you avoid it starting at all. The other thing to let you guys know about is if you don't happen to provide us an MPI, in a couple weeks when they start getting these patient asserted alerts to their direct messaging address, the provider will actually have an option to unsubscribe. It'll be at the bottom of that alert they get. They can click unsubscribe, they enter in a form, and then it hits the system, and that physician's been unsubscribed, and you guys didn't have to do anything at all. But we're trying to get ahead of that because we don't want it to all of a sudden get turned on for Dr. Sam Smith, and Sam Smith says, I don't want to get these. Why is this happening? So if you guys provide us this MPI level list or a practice level list, we can go ahead and quote unquote whitelist them to make sure they're getting notifications in the manner in which you guys have requested through your ENS subscription. So again, two ways. Within your patient panel, add an MPI column, populate it with the MPIs that you have, or through a separate file, you email us at Florida HIE service desk at anq.com and provide us the PCP level MPI and the practice level MPI. So,
and then I'll just add real quick to Brian's last comment around unsubscribing. Also, since we know that, excuse me, also since we know that hospitals are going to be sending direct messages through different means as well, also just be sure to double check who exactly it's coming from. Our direct messages will say, this is a CMS COP notification from the Florida HIE in the subject. So, if you don't see any reference to the Florida HIE, then it's, a pretty safe assumption that it's coming directly from that, indicated hospital. And you would need to either, I'm not sure whether, different hospitals, what sort of unsubscribe options they might be using, but at any rate, you would, want to just follow up with them directly in order to have those turned off or change any preferences.
Yeah. So with that, we've reached kind of the Q&A session, and we've got about 60 total users on this call, which we really appreciate everyone hopping on. I would like to try to do it more of it a one at a time. If folks want to do a chat, you can basically type in the chat your name and say I have a question. But I don't want everyone to talk at one time and no one can hear anyone. So if people want to type in the chat, I have a question, I'll call on you, and then you can ask your question. If other folks just want to type a question in the chat, I can go through and look at the question, and Ashley and I can take a moment to answer it. So with that, I'm going to kind of open it up here. And it looks like that I just received something. The question was, can we add an MPI in our next patient panel we upload in early May, or do we need to do this by April 30th? That's a great question. No, you do not need to do this by April 30th. You can upload it whenever you would like. You also don't need to upload your panel in the cadence you normally do. So if you normally upload it on, April 15th, and you're not going to do it again until May 15th, you can do it April 30th if you want. We will have a flag immediately notifying us that you've added that MPI column header to your patient panel. We'll flag it, we'll go in and update it, and then it'll be added in. So anytime you want to submit it, you can. You can do it 6 months out if you want. You can do it anytime you want. That's a great question, though.
Just know that if you are doing it after April 30th, that you might start getting the alerts to the direct alerts.
Sure. I see a Dylan Moore.
Yeah, that's me. That's Peggy. I'm using my
Hey.
kids
Hey,
account,
Peggy.
and I was able to change it. Sorry.
All right. How you doing?
Sorry. Thank you for asking. My question would be, once we do the change, do we have to first do a test with you before we put it into production, or we just shove it in the portal as normal?
Nope, just drop it right in your patient panels, and our system will automatically ingest it and process it. So there's no testing needed. There's nothing needed on your end.
Thanks.
Ruth, question from you. Nope.
Sorry, that's an error.
Oh, all right. That's
I
no
don't have a
problem.
question.
That's all right. No problem at all. And
Vignesh, I think, raised their hand.
yep, Vignesh.
Hi, I just had two quick questions. One is more of a clarification. When you guys are talking about sending the NPI numbers, did you say we can send one file with two tabs, one tab with all of our PCPs and their NPI number, another tab with our practice NPI number? Is that what you said? I'm just clarifying.
That is correct. So it's both. You can fill the one tab with the PCP level MPI. You can fill another tab with the practice level. The reason we did it this way is we know some organizations really don't have the provider's MPI. They maybe only have a practice MPI, and vice versa. Some organizations have both. So you can take advantage of both, cast the widest net possible to get practice level MPI and PCP level MPI added to our system, or you can pick and choose which one you want to do.
Okay, sounds good. Thanks for that clarification. Another question I had was, I see that you guys added observation as one of the event notifications. I know previously there was an issue with certain hospitals where there's a third party that pushes the data to you guys. Is this observation going to be something that's separate from that, where it's a separate altogether event notification from emergency to? Because like when I've looked at some of the notifications I've gotten before, I'll get like an admission to like an emergency admission notification, and I don't get a notification following up on that. And if I go look up the portal in the hospital, it would have been like an observation patient who had been discharged from observation, but we just never got a notification after that.
Yeah,
I know. Yeah, go ahead.
Sorry, no, that is a great question, and I appreciate you bringing it up, because that was a big gap that we were experiencing at the Florida HIE. A lot of patients get admitted from a registration, ER registration, then they get transferred, and then in that discharge, they get discharged under observation status, which typically means the patient class is outpatient, and we were not reporting on outpatient notifications. So because we made this change and the new COP rules and regulations required observation to be indicated, we're now going to be able to send essentially notifications with a patient class of outpatient as long as observation is marked as yes. And essentially the same goes for emergency and inpatient. If the emergency occurs, but the observation is marked as yes, you're going to see that in a particular identifier. In the HL7, it will be marked as OBS, which is Y or no. And the in the CSV file, it's going to be marked as observation status in an additional column at the very end of the daily CSV file, and it'll be marked as yes or no. And then also in prompt, you can go in prompt right now. For those of you who have prompt, you can log in, you can type in a filter that says observation status, and you can search for notifications under observation status, yes or no.
Okay, that's great. That's fantastic. Thank you. That's all for me.
Of course, of course. Great question, though. All right. If anyone else has a question, feel free to speak up, or again, use that chat. It looks like one more just came through. Bess, how are you? All right, so Bess says, if an alert is seen from a facility for a patient who is not on our patient roster, but the MPI matches a PCP on our panel level, does it mean we would get the notification, or we would get the notification the patient's not on our roster? That is a great, great question, and the answer is yes. So if you essentially send us a patient panel and you don't have Brian Smart, who is me, listed on your patient panel, but I walk into the hospital attesting that Bess is my PCP and you've got your MPI listed on your panel, we're going to be sending you notifications on patients who are not on your panel. And the reason is because the way the COP CMS regulations were written, if a patient comes in and attests and says, you know, Primary Partners is my provider organization, this is their MPI, and you provided Primary Partners as an MPI of that IP that MPI level, we're going to be sending notifications even if the patient isn't on your roster. And that's something that the way that the system works, if a patient comes in and attests and says, this is my provider group, or this is my specific doctor, and that doctor's MPI or provider group number is listed on your patient panel, we're going to be sending that stuff through. Great question, Bess. Yes, Nicole, we are going to be sending after this meeting the PowerPoint deck along with this presentation is being recorded as well. So we're going to send you the recording also. Marie, I see you raised your hand. Do you have a question?
I do. Thanks, Brian. I'm not sure if I missed this because I wasn't able to join at the very beginning, but I understand the need for the MPI so that you can then sort of do the cross-referencing of the direct address to deliver the notification. But am I also understanding that you guys are going to be using that to reduce duplication? And I'm not clear on what that is.
Yeah, so that probably is more of the primary use case for the reason we're discussing it with you guys right now. Because if you're an organization who has a bunch of providers that are receiving ENS notifications, whether it be through the Epic integration or something, they're currently getting those the way they and you have worked so diligently to have them be delivered. But when you add the COP regulations into the mix, now what's happening is all these other hospitals who are essentially going to start sending ADTs with MPIs, if an MPI matches up to a Nemours provider, they're going to get the notifications through direct messaging. And that provider may say, no, I'm supposed to get this through an Epic integration, the Care Everywhere platform. I'm not supposed to get it through my direct messaging. I don't want to do this anymore. So the ability for you to essentially allow us to whitelist those MPIs now makes it where if we receive an ADT inbound, we're going to immediately say, oh, wait, this MPI is attributed to Nemours, so we're going to route it directly to Nemours in the way they want to receive it versus sending it to the direct messaging and also the Care Everywhere platform. So it's almost a way to avoid duplication of notifications. But as we talked about earlier, in the end, if you do absolutely nothing and you just continue down the road as expected, the provider who receives a direct messaging alert through the COP routing, they'll have a little option on the bottom of that alert to say unsubscribe me. And as soon as they unsubscribe, they're essentially going to not receive anything else moving forward from the Florida HIE in regards to the COP routing notifications.
Mm-hmm. Okay.
And,
yeah.
go ahead, Marie.
No, I was going to say the unsubscribe option is excellent. I'm really glad that you guys are giving the providers the option to do that. But Brian, I did have a follow-up question, and if you want me to take this offline, please feel free to tell me. But in the example that you just gave, if we give you the MPI numbers, does that mean that the provider would then get the regular admission notification the way that we do now on that with that CCD into Epic, and then in addition they would get the COP notification, or you would suppress that COP notification altogether?
We would suppress that COP notification altogether.
Okay. All right. Thank you.
Great question.
And we should also just add, for clarification's sake, that if you are already set up to receive your ENS alerts via direct message, you will continue to do so. It's just that if you did not, if you did not provide us with your NPI, you might just be getting 2 alerts instead of 1 to your direct messaging inbox. So if that's how you're receiving your alerts now, nothing will change. You might just see you're getting 2 of the same alerts. One will look a little bit different than the other, but that's why we want that NPI number, so that we can avoid that.
Yeah,
Okay,
great
great.
clarification. Excellent.
Peggy, I noticed you raised your hand again. Did you have another question?
Yeah, thank you. I'm not Dylan. The question is that since right now the notifications, they're sent all to us as a payer or MMM of Florida and the other ones, not directly to the providers. Will we still receive double or something like that? Because we do send our patient panel to the other end, in our case with Curator, and then they do route it notifications to the end user.
Yep.
So from our side, do we need to do anything to avoid any duplication?
Well, if you're working with Curator, which I know you are, and Curator's routing these notifications downstream to their providers, the providers may start to say, I already got this notification. It went into my inbox, but it wasn't through the Curator app. It was through my direct messaging, and I don't want to get it. Why is this happening? You can say, well, send me your MPI. I'll provide it to the Florida HIE and make sure that doesn't happen anymore. Or the provider can click unsubscribe when they get that alert, and they won't receive it anymore through their direct account. So the main goal here is to avoid the providers that you guys work so closely with, the providers who you rely on to receive these notifications, take action on these notifications, to not getting overwhelmed. And then they just start to say, forget it, I'm just going to put all these in the junk and not do anything else.
So then us adding the MPI, let's say, in the regular monthly file in the column that you mentioned, would avoid them getting the duplicity.
Correct.
Specifically for the providers that already have direct message.
Correct. And just to clarify, it doesn't need to be in column S. It can be in any column you want after the cell phone.
Yes.
All right.
Yes,
great.
or after the custom field, like you mentioned.
Yep. Either way.
And for curiosity, so then that means that you guys have already like a directory of the providers who have direct message without us providing it. You have it on your side with Direct Trust, and then you're sending that directly, right?
Exactly. The Direct Trust is a national system that basically stores all the providers' direct messaging addresses, and they're mapped based on the MPI of the provider itself.
Got it. Thank you for verification.
Of course. So this has been great. Ashley and I really appreciate the time to sit down and talk with everyone about this. We know that there's going to be some ebbs and flows with this moving forward, but we feel like, you guys do your part, we're going to do our, and if anything comes up with regards to questions or anything that pops up in the middle of the night, you feel free to email us, Ashley or myself, and we're happy to answer any questions. But with this, just submit your patient panels with those MPIs if you'd like to include them, or provide us a separate file with the MPIs and we can load them in. As you start to submit those patient panels or the individual files, you'll see that I start creating tickets on behalf of your organization through the service desk. So you may get CC'd on some of these tickets, notifying you the work that we're doing to make sure the COP alerts are being routed or suppressed based on the way you'd like us to do that. But again, if you have any questions, anything at all that pops up, feel free to reach out to Ashley and myself. And we cannot thank you guys enough for your time and your support in this matter, because I think we're all just trying to figure it out and go through it. But the Florida HIE has a great system in place, and I think it really checks all the boxes to make sure we're not overwhelming these provider groups. We're also making sure that we're keeping to the COP participation requirements and doing things as best as possible. So Ashley, any last words on your side?
No, I just say, we just once April 30th comes, next Friday, we are going to be turning on the functionality individually for hospital as they're ready to go live with routing these alerts. So you might not see, a huge floodgate open. But, we definitely want to hear back in terms of how it's going for you, just generally. So please feel free to reach out to us. You might see an email or like a survey come across from me mid-May with a few questions, just asking you what your inboxes are looking like. Just, in terms of general traffic, whether it's coming directly from us or, the other hospitals we do. We do want to just kind of get an overall sense of how you guys are being impacted by the rule. Again, whether it's coming, the messages are coming from us or someone else, so that we can work collectively with the hospitals across the state to work to optimize this and make it a good thing as opposed to a bad thing. So
great. All right. Well, thank you all so much for the time again. Appreciate it, and hope everyone has a wonderful afternoon. All right. Take care.
bye-bye.
Thank you.